I'm Reed Price. I'm the director of the Bainbridge Island Senior Community Center. And today, as something to talk about, we're going to talk about sort of an old standard, unfortunately, in our world anymore, COVID-19. And Dr. Andrea Chymiy from Bainbridge Prepares is here. And so is Dr. Neil Baker, who has appeared before. And I appreciate you both showing up. We're going to start with Dr. Chymiy. And if you have any questions, you can always put them in the chat. We will also give you a chance to open up your microphone and ask them directly. And so one of the things that sort of sparked the idea of having this conversation today is that the city of Bainbridge Island and Bainbridge Prepares are working together to start public available testing. And so maybe that's a good place to start, Dr. Chymiy, to talk a little bit about how that's going to be available at least in a test way this week, and I imagine for a while to come. Tell us a little bit about that program, if you could, and thank you so much for joining us today.
Okay. Good morning, everybody. So yes, the Bainbridge, actually the city of Bainbridge City Council approved funding for a test site here in Bainbridge, right in front of City Hall. That's going to open Wednesday, and it's going to be open Monday, Wednesday, Friday for the month of November, starting, I guess, Wednesday of this week. So the test, we're practicing stuff today to get all the kinks worked out, but it will be running as of Wednesday. It'll be in the afternoons. I think it's 1 to 5 p.m. And then after the farmers market season ends, I guess in December, we're going to have Saturday testing as well. It's supposed to be by appointment only, but there are a lot of slots, and there's a link. I can send out the link if you want, but I think a lot of people probably already got it. And you can also find it on the City Hall website page for scheduling. So you can actually get tested for any reason. It talks about symptoms and asks questions symptoms, but they're going to test anybody who wants it. So for any reason, I think a lot of people want it before they travel somewhere. That's what we're seeing so far. We haven't had a lot of sick people trying to schedule yet, which is good. But yeah, you can still get tested with your doctor's office, but if this is a good option for you, it will take insurance. And if people don't have insurance, then they'll be covered by the CARES Act. So it'll be free to them. And the testing will be sent to University of Washington and should take 1 day to get results. So
great.
We're excited about it.
And the value of testing to our wider community, it seems, is that if someone is suspicious or concerned, they can immediately get results, and that will reduce the chances for secondary exposure, right?
Exactly. I mean, we've had several incidences over time and lately where a person in the community who has a lot of interactions with people has tested positive, and those people who are exposed, obviously are concerned. And so we recommend, if you're exposed, which hopefully none of you are, that you obviously quarantine yourself, but also get tested about 5 days after exposure. And this will be a good way to do that, because you may not have any symptoms, but at least you can get that initial reassurance that so far so good. So that's a good option, at least.
And in that regard, what are the most likely situations where we've seen multiple exposure? Do we have a sense of the kinds of settings and areas of concern? I know my family has been, we have a newborn in the wider family, and before I ever go visit my daughter, I try to either arrange a test or quarantine for long enough that there's no sign of at least symptoms.
Right. I'd say from working at the I've been volunteering at the Bremerton test site, which opened last week. And the biggest concern patients had, or people had coming through, was that they were exposed to another person at some kind of get together, or kids, it was like sporting events. But family get togethers, or kind of medium-sized group get-togethers, which are still happening, were a big source of concern. So whole families were coming to get tested. There's also been people going to the hairdresser, And if the hairdresser has it, then they have a lot of people they have to contact to get tested. Right. And then I have a patient who got it, we think, at church, and apparently they weren't wearing masks at her church, which I thought was strange. But anyways, that's anywhere where there's a group, anyone more than just your nuclear family. I mean, even that, but it's all possible.
Yeah. Yeah, and I did see on the New York Times website this week last week a graphic that very clearly indicated the value of mask wearing. The idea that even if you're not in a position to wear a mask like the kind that you wear at work every day, an N95 mask, multiple people in contact wearing masks can dramatically reduce the exposure. Can you describe just how we have learned even more about how that is true? Definitely.
I mean, there's various research studies coming out now. I mean, they're all anecdotal because they're not telling people not to wear masks for research studies. But one example I think I might have mentioned before is an event that happened in Korea, but a Starbucks, two-story Starbucks in Korea, which was open sometime this summer. The person who ended up being found to be the source of infection came in, went upstairs, got her coffee, and then sat there for 2 hours drinking her coffee. And they had 46 positives come from this one exposure because people would come in and get their coffee and drink it, right? Take off their masks, drink it. But the group that did not get it was the group that never took off their masks, which was all the employees. So none of the employees were allowed to remove their masks. None of the employees got it. And they weren't wearing N95s. They were just wearing whatever Starbucks let them wear. So that's just one example, but masks definitely slow down transmission. And we all, I think, know that.
Well, and that's sort of a story that we didn't have actually earlier about the idea that although the weave of a cloth mask is not going to be one that could stop a COVID virus, it sounds like it might stop at least some exposure. It might work actually in your self-interest as well as an altruistic move.
Right. I mean, we keep learning more and more. So, and it's not perfect, but at least it will slow down the transmission. So the longer the exposure, the more the risk. But in a brief exposure, it's definitely going to help you from what we see.
Lee is asking, what is the latest research on contact exposure? Should I be concerned about the risk from things at the store that someone with no symptoms might have touched? So fomite, touching a contaminated object. Should I try to disinfect things coming into the house? New information about that?
I can't cite any specific studies, but we've definitely been learning that fomite transmission is pretty low. It's a pretty low risk exposure compared to the aerosolized exposures. So that cleaning of the mail and postage packages and groceries is much less of a priority than what we're seeing.
At the senior center, we're accepting books and puzzles and magazines for swapping. And what we generally do is allow somebody to drop it off and we leave it there for a day or more, and then we put it out for sharing. And it sounds like that's a perfectly adequate sort of protection.
Yeah, that sounds reasonable.
So I think that you probably don't need to keep your groceries in the garage for a week anymore. But
and if you're really worried, you could get the Lysol spray and just spray it down, but not the food, maybe just the mail.
So that is encouraging, and it does sound like the exposure. One of the things that Dr. Cowan said very early on in one of our discussions here was the idea that that dosage, that the amount of time and the intensity of the exposure seems to be correlated with the sort of severity of the disease, of the infection. Is that still holding up?
Yes, I mean, most of that evidence comes from healthcare workers, but it does seem that the cumulative exposure matters. And there's even some hint that small amounts of exposure, be it a healthcare worker who doesn't wear an N95 and works, they tend to, at least from what we've seen in some cases, get antibodies and not ever show signs of an infection, but it's all early. But heavy dose exposure, like the aerosols, which none of us are exposed to, hopefully, are very risky. So but
it does sound to me like if I were trying to be cautious,
Mhm.
I would look at things like not staying in a restaurant for 2 hours, maybe not trying to have gatherings with people I don't know for longer than that. And if I am going to be meeting with people, try to be in a well-ventilated, even outside area.
Definitely. And that probably leads into something else we're going to talk about, but Thanksgiving is a big concern for healthcare providers as far as their patient risks. I'll tell you, my family, we usually go out of state to my in-laws. We fly there. We have this whole big weekend and everyone, all the grandkids stay together in one big sleeping area. That is totally not going to happen. We're not going this year, and we're going to have just our family and possibly my parents if we can get an outdoor heater installed where we will have dinner outside with the heater. But that's all we're doing because it's too risky.
Yeah, I'm guessing there's been a big rush on propane exterior patio heaters.
Yeah.
One of the other things that we've done at the senior center is, with the assistance of the city and CARES funding, purchased some HEPA filters, some air purifiers. Do you have any understanding about the value of ventilation and ventilator cleaning? Is that at this point basically a judgment rather than sort of tested?
I mean, I think that's going to be an evolving area, but for most of us, I think we're just going to be opening windows. You know, there's not a ton of like recommendations on that yet, but I think the airlines are finding out how well they're doing with their filtration systems, and that seems to be effective in most cases with their really, really good air turnover of every 6 minutes. The air in the airplane is clean. So if we could all do that, that'd be probably a lot better, but we probably cannot. So
right
now,
so it's going to be, we're going to meet Jimmy Carter's goal of wearing sweaters all winter long. What can you tell us about I know that there's been a lot of sort of freighted discussion about vaccines, but and I know there have been some stories in the news about vaccine trials being halted because of concerns. Mm-hmm. Do you have a sense of where we are on the search for a vaccine that you can share with us?
Obviously, we didn't get one by election day, but that's totally okay because we all want them to do a good job and be thorough as opposed to too fast. All the vaccine, I mean, the 3 most prominent vaccine trials are still progressing. It's really normal to temporarily halt them if there's any adverse events. And we're just hearing about it while it's happening, which usually no one pays attention, right? Because it takes years to get a vaccine and we're not usually in an urgent rush. So none of that is concerning from a scientific perspective. All the 3 of those good candidates seem to be moving forward. But I mean, realistically, the anticipation is that they will be rolling it out in late winter, early spring of 2021, and it will be targeted at y'all and healthcare workers at first. So if anyone remembers the H1n1 pandemic, which seems so minor now, back in the late aughts, like it was just one more shot that we made available to pharmacies and doctors' offices. And then we had certain criteria for who was the target group. And eventually we opened it up to everyone. But at first it was like for months, it was healthcare workers and people who are at risk. In that case, it was pregnant women, overweight people, and older patients. And so we'll be targeting it again, same thing, pharmacies and doctors' offices, and probably some other health department sites, I anticipate. But yeah, it won't be for several months before we even have a hint of that out here.
So I know that there's so much coverage of this that it's very hard to keep track of the concern. And I recognize that, watching some of the news websites that we've seen, deaths dip and then climb. I don't know whether, as a physician, do you have a good sense of what the therapeutic situation is now in terms of how are we able, do we know more about how to treat and prevent, or at least try to avoid fatalities in this situation?
Yeah. I mean, it's definitely encouraging. I'm sure everyone's seen the cases going up, and some of that is due to more testing, but there is also just definitely an increase in cases now as the weather's getting colder. But the deaths, although slightly increased, are not going up like they were in the spring, and they're way less way fewer deaths right now. And so we've learned a lot about how to treat the disease when you get it, between the steroids that we're using and just positioning of patients even, like lying face down, which sounds uncomfortable to me, but if it's going to help you avoid a ventilator, totally worth it. That seems to be helping quite a great deal. So the experience is increasing dramatically, and that's really showing up in the death rates. We're still going to have more death rates going up because the winter is going to bring a lot more cases, but hopefully it'll be a lot smaller rate than what we saw in the spring. And that's very encouraging.
So the reason that we might be associated the cold weather with increased transmission rate is just because we're going to be together closer indoors?
Yeah, that's what we know. It doesn't seem like the virus doesn't love cold, but it loves being inside. So that's what we're seeing so far, and in Europe too. So.
Yeah, well, it does seem as though, we're, I don't know whether you want to call it a third wave or a second wave, but it does, obviously, we're seeing a lot of activity going on right now across the country and even in this state. And so I guess that there's a role for all of us to play in that in terms of just encouraging each other to hang in there. Yeah.
And I mean, I know it's really hard. I know for us, Thanksgiving is like the one thing we've always done. And I'm sure you guys have family members or friends that you really want to get together with. And it's not like illegal to go hang out with, your two special people, but try to just stay apart and, smile at each other across the 6-foot outdoor space. I mean, it's really important to have social contact with our family and friends too, but we've got to be real smart about it and just don't get in a group inside. It's so cozy and warm, but let's try to be outside with jacket.
There you go. Yes, it's cozy. It maybe is not all it's cracked up to be this winter anyway. But it sounds like we'll be, every month we have we're getting more knowledgeable and we're getting closer to some treatments like vaccines.
Yeah. Okay.
So what's your advice about testing? If you were, when should I get tested? If, obviously if I had you just said earlier, if I have knowledge that I was exposed to somebody, right. I should be careful, stay away from other people for 5 days and then try to line up a test. What are other instances where testing might be appropriate?
Well, definitely with any symptoms. And that has expanded now. It used to require a fever, but now we just say any of it, like 8 or 10 symptoms, including diarrhea, headaches, the obvious ones like cough, runny nose, the sense of taste, but the lack of, you don't have to have the fever to get tested anymore, which is good to know. We've tested a bunch of people who have diarrhea recently and it wasn't COVID. So something else is going around, which is weird.
I was surprised. On Friday night, I felt fatigue and muscle aches. Yeah. So I called my healthcare provider, and they were able to get me into a test at Kaiser on Saturday afternoon. And this morning I was able to get the test back that said I was feeling better by the time that the test came back, but it meant that, and it was, aches. It didn't seem like something that could be COVID, but right now, because of the variety of symptoms, really, if you're feeling a little lousy, it probably is good to consider it, right? And we have plenty of tests.
We do. We now have a lot of test availability, and honestly, we're going to be fine with testing anyone with any of those symptoms. So basically every single cold that sticks around for more than a couple of days, we're going to end up testing you guys. And that's totally fine now that we have a lot of testing capability. But anyways, also just people who've been to a group event and are concerned, or people who are about to go to something, even if you've been really cautious. Even though we're going to sit outside, we're still going to get tested before Thanksgiving if we can, just to feel good, because my parents are in their 80s and I don't want to have that on me. So yeah. So pretty much any reason you can get tested, but you definitely should get tested if you have symptoms or if you've had any exposures that you're concerned about.
Don't worry about the background noise. We're fine.
All right.
It's okay. We've had roosters in the background, so we're in good shape around here. Can you tell me about the different kinds of tests? So I know that there's some sort of saliva test being.
Yeah.
What are our options? Sort of.
I would take whatever they can give you, but the 3 tests that we are mostly using, there's the nasal swab, and it's actually usually now you don't have to get the deep swab, which feels like it's in your brain. You can just do a nasal, like right nostril test, and it's self swab, so you can do it to yourself. So it's not too bad. There is a rapid test, which is the same kind of modality, nasal swab, but the rapid test is immediate, like 10-minute results. That one is somewhat useful if you have symptoms, but if you're getting screened and you don't have any symptoms, it's not very accurate. That's the one they used at the White House, and we found out a little bit about that accuracy being poor. So a lot of places have that, like in the emergency room. We have one at our clinic, but we'd only use it if someone's sick. So the nasal swab that's sent and done with PCR testing, like at UW, that one is quite accurate. And then there is a saliva test. In my practical experience of administering that, it's a lot of spit. So it takes a while to do that. You have to get 2 cc's of saliva, and you can't have eaten an hour beforehand. And anyways, so it's a little bit impractical, but it's about the same sensitivity as the nasal swab. So they're both good. I was thinking it would just be like lick a stick, but it's much grosser than that. So nasal.
Okay. And are there any questions from the audience here, from people who are attending?
Yeah, how do we go about scheduling to get the tests over here at Bainbridge?
Yeah, so hopefully, since you're on this call, you probably have internet. So there's a website, right on the Kobe website for the city, there's a link to the scheduling, and I can see if I can just, I don't know, can I put that in this talk?
Yeah.
Try to find it. Okay.
It's right on the front page of bainbridgeislandwa.gov.
Yep. So I'll throw it up here right now. But yeah, you basically just register for testing and see what the availability is. And let me see. Oh yeah, or go to the main page. Here we go. Show everyone. Okay. So yeah, I'll just put the link in here now if anyone wants to check it out. But it's super easy. There might be more spots opening up. It looks like this week is full, but I think we're going to be pretty quick testers. So we'll probably be able to open up slots, and it should be pretty available. I suspect the Wednesday before Thanksgiving will be popular. So if you want that done, sign up now.
And what can you tell us about the people who are doing the testing protocol, doing the work at the city?
So there are several groups of volunteers helping out, and we've had a great response with volunteers. We have the Community Emergency Response Team, CERT volunteers doing traffic, which is basically pointing you the right way. And then we have Medical Reserve Corps volunteers who are the doctors, nurses, other medical healthcare providers from the island doing the actual testing. So, and it's not even us, we just hand you the stuff and you do your own and hand it back to us. So it's very low. I mean, there's not much risk to either party, and we're all safe. And we're encouraging people to come in their cars. So we basically hand you the test, you roll up the window, swab yourself, hand us back your specimen, which is already in a little bag. So it should be really easy and, easier than voting. Huh.
Great. And I know that you are going to be working on that today. So thank you so much for helping make this happen.
Can I have one more question, please?
Yeah.
So if I would get it done now, is there any reason why that I would not be able to get it done again, say before Christmas, for example?
Good question. No, you can get it done as many times as you want.
Thank you.
And your insurance will keep paying for it, like mine, which is paid for 5. So
That's great. Yeah. I feel as though it's both beneficial for all of us to feel comfortable being able to get easily tested, and for our community to know. One of the things that I think that we didn't know a lot in the beginning was how prevalent was the disease in our midst at any given time. And it's, we should assume that there's risk everywhere because it's such a easily transmitted disease right now.
Definitely. And just to give everyone in Bainbridge a kudos, there have been almost 1,600 cases in Kitsap County and only 70 cases in Bainbridge. And for our population size, that's much lower than our percent of the population. So people are doing a really, really good job.
And when you say they're doing a good job, what do those behaviors look like?
I think it's mostly mask wearing and also really just doing way less fun stuff than we used to do.
If it's fun, think twice.
I know. Just go for walks.
That's right.
Yeah. I mean, I think we've done a great job really physically distancing. And thank you, everyone.
And thank you for dropping by. I really appreciate that. And we're going to let you go because I know that you've got a busy day. So thanks for the half hour of your time.
Thanks, you guys. Good to see you.
Good to see you.
Thanks, Andrea.
Now we're going to turn the microphone over to Neil Baker, who has been a observer of some of the larger sociological trends related to the situation. And Neil, maybe this with you is backing up a little bit off of Bainbridge Island and looking at the wider region and country. What are you seeing?
Well, maybe I should tell you, Rita, I was thinking about, I should tell everybody up front the way I think of what I may have to offer today.
Great.
First. And so I am, while I've spent 30 years in healthcare, I was mainly in quality improvement. I'm not here representing myself as an expert in COVID, in infectious disease, in public health, or in epidemiology. So I'm a citizen who's reads a lot, and I do have some extra background in assessing quality of evidence and opinions in the medical arena, many years of that. And what I realized is I've researched this. I've done a lot of research and reading over the years. It's been directed to the primary question I've been concerned about is how do I manage risk of getting COVID, and how do I help my family and people close to me manage risk? So I don't know all the ins and outs of vaccines and tests and things like that.
Right, and that's sort of why we asked Dr. Chymiy here, because she's paying a lot of attention to that because she's treating people.
So I have gotten, and I've also stopped chasing down a lot of threads of conversations. Like I stopped researching herd immunity about 3 months ago, and it's still going on. But there's about 6 resources I just follow now, as opposed to continuing to research these different questions. So, but it was in August that I worked hard to form bubbles. My wife has a son and daughter-in-law and 2 grandchildren on the island. I have a son and daughter-in-law and 2 grandchildren in Seattle. So we worked out a bubble system with everybody, which has, and I could talk about what it's like generating those conversations and sustaining that bubble. And the other perspective I have on this, what you asked about the greater national situation, I can't focus on my own personal risk management, family and friends, unless I see the context we're in. And I think the context we're in is a complete muddled mess. I'm very opinionated about this. I acknowledge it up front, but I think we basically have a third world response to it. There are many African countries, multiple African countries are doing better with this. And I don't see a coherent, consistent message from very many political leaders. And we don't exist with a national plan. So what that does is it increases the burden of individual and family and school system trying to assess what's going on. It's very, very demanding. So that's what I see. And after following these sources over multiple months, I'm of the opinion we know what to do. We know what to do. There's no easy answers, but if we want to get more control of the virus, open up more of our society, have more flexibility, we know what to do. So I could address some of that, but I could also address how we went about the bubble or any other questions or points of conversation. So Reed, where would you like to go with this?
Well, let's start with the question I asked to begin with, which is, we heard that things have been pretty well controlled here on Bainbridge Island. But in your review of the wider community region, and you hinted at this, that's not the case. There's a wide variety, but generally a lot of exposure and transmission right now.
Yeah, there is. And I just looked at data today for Kitsap and King, and it's been going up like this. It's nowhere near what I would consider crushing the virus. If you don't, my opinion from my reading is if you don't crush the virus to near zero, then you are at risk for super spreader events. And even then, the new normal is being careful about social distancing and masks. So I see I don't see any way around being for myself, believing and being very systematic about how I approach bubbles and what I do. I pretty much am isolated. My wife and I are pretty much isolated except for being in these two bubbles, but we're constantly reassessing what's going on in those bubbles. I go to the grocery store. I limit the number of other exposures. Yesterday, we were going absolutely crazy, so we dropped into Eagle Harbor Bookstore and the new olive oil store, but we don't stay there very long. But any kind of indoor activity increases risk and exposure. So did I answer your question? I'm not sure if I did.
Well, I guess so. You're saying that the transmission rate, and the last time we talked, you talked about R0 and what that means, is not sufficiently low in either King or Kitsap County for us to expect that we are, we should expect to be seeing a growth of the virus right now.
Yeah, we're nowhere near what we would consider levels to say start like New Zealand, starting to open up and stop using masks and things like that. Nowhere near that. What I've come to follow the number of new cases per day, the literal actual raw number of new cases per day. And the numbers I use for the goals are either the optimal goal is near zero new cases per day for 14 days. Or I follow from Michael Osterholm, who's an epidemiologist at the Center for Infectious Disease Research and Policy. Countries that have controlled this are about 1 to 2 per 100,000 per day. So the reason I follow the raw numbers is it's so easy to misinterpret. I have a family member who works with the school board, and we were looking at, she got me into these numbers again. I go, my God, you look at a number and you think you understand it, and then you see that the units they're using is it's per 100,000, or you can see the number of new cases, but it's averaged over 14 days. So for personally, I just look at the raw number, and King County is going like this, Kitsap County is going like this, and at no time that I've looked at this, if we spent anywhere near 14 days in Kitsap County, even at 1 to 2 per 100,000. So I don't think much has changed. I just think we've been in a continuous fluctuating kind of mess.
So let's switch there to the bubbles, because if we're going to maintain some connection with people, one of the ways we can do that is sort of identify people that are going to obey these same practical safety measures as we. And that's what a bubble is?
Yeah, it is. And I'll tell you what I found with this is I find, just to know, my far background was in psychiatry. And so I'm pretty experienced in having difficult conversations, but I found these conversations very awkward and potentially kind of provocative for people, because we're not used to asking people about specific behaviors. How often do you go to the grocery store? Do you wear a mask? Do you meet with people indoors? And it can feel judgmental, or like I'm judging people as right or wrong. And so I've learned to preface these conversations up front, which is, this is about risk management. I'm not about right or wrong or judging good or bad. This is making everybody aware of the risk that we are willing to take and what we have taken, and being aware of others' limits with risks. So with my wife's daughter and son-in-law and their family, they have his mother come in once a week. So we talked not only with them, but with her and her husband, and went through and talked about things. And we went through a similar thing with my other son and daughter-in-law, and it turns out that the families are somewhat different. The family on the island wants 2 weeks between any contact with the Seattle family. The Seattle family is comfortable. Some people say, if you trust him, I trust him. I'm not that way. I got to have the conversation. But my family in Seattle is okay with us not having 2 weeks with the other family. So it gets kind of complicated. After you think through every time, let's see, we have 2 weeks. And then what happens is my wife goes with her grandchildren and I go to my grandchildren, and then we don't mix. Like I don't come back before all her grandchildren are away, so that there is a quarantine between the two bubbles. So it's been kind of ridiculously complicated to work out. I had to make these calendars and things, and we had to think about, and also it gets confusing is it's easy to fall into, even if I strongly believe we shouldn't judge other people, it's easy to fall into that. And I realized, no, this is about, because one of the parents who are unmentioned put on Instagram a photo of an outdoor meeting without mask with friends. And they were closer than 6 feet even. I'm going, oh no. So that created a need for a quarantine and another discussion. And you can imagine that was kind of awkward. And it wasn't that, hey, we make these judgments, just be aware, we want to know if that happens. So
I wonder if there's anybody who's attending today who has been wrestling with this question of bubbles and grandkids and that sort of thing. Have any of you been?
I will mention the shorthand we've developed, that if you haven't talked to somebody directly, they're not in the bubble. I don't care if they're a friend or family member. If they haven't talked to everybody in the bubble about the behaviors and had that face-to-face, they're not in the bubble. And if they're not in the bubble, it means you're not indoors with them. If you're outdoors, it's 6 feet with masks.
For anybody who's in the bubble.
Yeah. Yeah. For somebody.
I mean, I think about, like in my situation, I live with my kid and spouse, and the mother-in-law is occasionally visited. I don't have direct contact with her, but there's an example where I don't know exactly what she's doing, but I know that she's talking with my son-in-law. And so there is exposure risk there.
Right. I think that's a good way of putting it. If I don't talk to somebody, like my family in Seattle has a nanny come in, I didn't talk to her directly because I felt it was getting in the way of a complicated relationship. They have 2 little tiny kids and they're both attorneys, and they got to have somebody in. So it is a risk, extra risk that I acknowledge, that going in without having talked to her directly, and it makes me uncomfortable. But I end up having to go through that decision process each time, but I've gone over.
So anybody else had this experience?
Yeah, I do. I've had this conversation with my daughter, and who lives up in Hansville now. I've not seen them face to face for quite a while, actually. Any of the people in the family, in my close family, they're going to have Thanksgiving with the 3 grandkids who are all in their 20s, and Mike and Jennifer, and my daughter is a little queasy about my coming to their home. If you come, Mom, wear your N95 or I'll get one for you, and you need to sit 6 feet away from all of us. But still then, she doesn't sound like she's really interested in that. She said, and she ends up by saying, "It's okay, Mom, I'll bring you the food." So it won't be that I'll be out of the food situation. I'm wondering how you feel about that.
Oh, so are you asking me?
Yes, I am. Thanks, Neil.
Yeah, well, I would say that she's being very conservative about it. And if I were in your shoes and I wanted to find a way to open it up, I would try to understand what she's basing that decision making on, and how she decides what's in a bubble, what's not, what the level of risk are, what the behaviors are. So
that I could tell you, because the only reason I'll tell you that she works in a medical facility, so she
Yeah.
has a good background on this.
well, that also, personally for me, that would immediately give me pause, because if she's actually involved clinically with people, there's going to be greater risk of exposure there. So I would have to think long and hard before I got into a bubble with her and did, which means if I'm in the bubble, I can go indoors without a mask, basically, or outdoors, I could be with her without a mask. I don't think, I would have to think long and hard and talk more before I did that. That's the unfortunate and insane and very difficult thing about this, is that we can't wish I wish that these risks would go away. And it makes me very irritated chronically, because I love my son and daughter-in-law and grandchildren, and yet I have to worry about this every single time because of the nanny and stuff like that. So this is not easy.
So anybody here on the call feeling a sense of loss about the upcoming holidays? Anybody like to share anything about their changed plans this year? I know that we aren't going to have any get together at all, really, except with the people we're already living with. And that's a reason why. Lawrence or Bonnie?
Yes, we feel that sense of loss because we always shared a great deal at Thanksgiving and had people and whatever. And my son and his family are here, but I know they won't come, and we get it. So our plan is we're making a dinner and taking food to people, individuals, without eating with them or anything like that. So we're trying to feel like we're sharing, but when you get right down to it, we're alone. It's hard. It's real hard.
I feel that the positive side of this is that we are older and retired, and our family lives in Barcelona, Spain, so we communicate via FaceTime or any kind of electronic media. And but we find that this period of time that we're kind of secluded at home together has enhanced the relationship as we've grown older, and we're having fun together and not worrying about going out. As far as turkey is concerned, who needs it?
So Jim, what from your family, what do you hear about things in the other over in Spain? How are things?
Locked down. They're locked down. They have a curfew at 10 o'clock at night, and the whole city is closed. And if you were walking around in Barcelona with even a mask that does not cover your nose, you were arrested, and the immediate fine is 100 euros right there on the spot, or go to jail. So they're very serious about this. But of course, they live very close to one another. So it's a packed city. But everybody, they wouldn't think about going somewhere without a mask. My son-in-law is an actor, and his 3 shows were canceled, and they just shut down. It's as simple as that. So we're busy on Google and FaceTime, and enjoying our life as it exists today as much as we can.
That's very good thinking.
Good.
Bonnie, did you or Lawrence have a response? I don't want to cut you off.
Well, I think it's a positive outlook, and I hate to use the phrase, but it is what it is, and we're just trying to make the best of it. And thank goodness we have the technology that we can spend time with family, at a distance.
And friends. Mm-hmm.
Yeah, and friends. Karen King, I think you had something you might want to Am I right about that? Yeah.
Oh yeah, our son lives with us, so it's kind of nice, and he works from home, so it's been nice having a child living with us. And I talk to my daughter every day, either text or email or something, and she works from home too. So we're just adapting and making the best of everything. That's I think about the 1918 plague
All we can do.
and what the people had to deal with then. I mean, they didn't have this wonderful technology we have. So that's how we're adjusting, and we are dealing with it. And we get out and walk every day. I don't care what the weather is. They said there's no such thing as bad weather, just bad clothing.
There you go.
Yeah, see, there you go. So,
Well, there's another thing about what we're doing. We also have a daughter in Chicago whom we meet with, she and her significant other on Zoom, and we have Zoom dinner parties and cocktail parties and so forth. And it's not exactly the same, but since we know each other very, very well, it takes on a more significance than even this. But I mean, I look at this relationship that we're having here and experiencing right now, and it's to me a highlight. And I attend these kinds of sessions as much as possible.
It keeps us connected.
yeah.
And it's a good part of our routine in our day, and that's really helpful. Routine is really helpful. Even if you don't do that many things, if there are things
Very
that you
much so.
do, it's very important.
I agree. Absolutely agree. I'm so
So
happy
this has been
that
wonderful.
Reed set this up, because it's been such a wonderful outreach. I've even met more people than I have before. It's been
Well, and
great.
thank you for all of you for
Yeah.
showing up. It helps keep the momentum going. And thank you, Karen, for stepping up to help with hosting some of these. That's great.
Oh,
Yes,
I enjoy it.
thank you, Karen.
I love it. I'll do more if you want me to, Reed. Just let me
There
know
you
when
go. All right.
And Neil, that was such a great job. I really appreciate it, and I understand and really appreciate your candor. I would be more verbal than you probably, but I understand exactly where you're coming from.
Antagonistic.
Antagonistic, I guess, yeah.
Well, so
Thanks very
Neil,
much. I appreciate it.
I mean, you mentioned at the beginning, and I think we heard a little bit from Jim about the fact that we're not responding to this as a country very well at all, and that means that our responsibility becomes very personal. You mentioned New Zealand, which has the benefit of being somewhat isolated. Spain is not that way. It sounds like they're doing a completely different sort of response. Do you have any other examples of places where you?
Well, the website that I go to is endcoronavirus.org, and it has a list of countries that are beating the virus. And I'll count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 30, including such countries as Vietnam, Thailand, Sudan, Taiwan, Senegal, Singapore, Niger, of course, New Zealand, Mali, Laos, Haiti, Burkina Faso, Australia. So yes, it's not just island nations who've been able to do something about this. Then they have another level, which is in yellow, countries that are nearly there, and then countries in the red that are having real problems, including, of course, the United States and Spain. But so there are countries that are able to do this.
Now, I just went to that website and I put it up in the link.
Yes.
Can you tell us sort of how we might navigate that?
Yeah, it's a website. What you do when you go to the website under data, if you put your cursor over it, you can click on countries and U.S. states. And then it divides up the graphs so they're green, yellow, and red that show the coronavirus. Incidentally, even with these graphs, it's the vertical indicator varies. So a level that looks the same on one graph is not necessarily the same. It has numbers below the graphs. So to look at, for example, in US states, if you look at Vermont, it looks like the green is going up, but then if you look at the recent new day cases, it's 19. Whereas if you look, say, at or Arizona, it's a red. It looks like it's gone up the same, but the recent new day cases is 1295. So it's a little confusing there, but it gives you a rough idea. It also explains under green zones what a green zone is, what the methods to crush a virus to zero, and then it has other resources. But the green zones tab really explains in very easy to understand with graphics how you get there and stay there with references to papers if you want it.